You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. Nobody should be wearing a loose-fitting denture. And we're talking about dental implants today. And here we have an expert on the topic, Dr. Ted Morgan. Dr. Morgan, welcome to the program.
Good to be here, Randy.
Now, before we get into today's topic, for people that don't know your practice, I guess in your practice, you do just about everything. You make crowns in a day, you do dental implants. Go ahead and tell us, what are the different services you offer?
Well, it's easiest to wrap it up by saying we do whatever it takes for people to keep their teeth, or if they've lost their teeth, to have good, secure teeth to chew with, to smile with, just to have a life that isn't interfered with by their dental situation. So, we've devoted years to restoring and fixing people's broken down teeth and keeping them nice when they're fixed.
Now, it's kind of a concept, I guess, where you do a lot of, everything under one roof there, right? You don't have to send a lot of stuff out.
No, but we don't hesitate to do it if we have to. But okay, no, good. We are able to do most things right in-house, yeah. We offer a lot of services. We do veneers, smile makeovers. We have lasers in the office that we use to help keep people's gums healthy. We make crowns in a day.
So you have a machine that actually makes crowns right there?
Yeah, instead of the old way that we used to do, which was we'd make a temporary and put on the tooth while we wait for the crown to come back a couple weeks later. And sometimes a temporary would come off. So now we have the machine do it same day. No temporary, it's permanently on right then and there. And people are loving that.
Now, you're big on dental implants. You don't like loose-fitting dentures.
I don't, no.
Like, nobody should be wearing a loose-fitting denture.
Nobody should be wearing a loose-fitting denture. I'd rather nobody wore a denture, but...
In fact, you told me, I want to almost quote you, you said that you do make dentures, even though you'd prefer to give them like some implants to lock it in, right?
Yeah.
But you say that you tell them it's going to be maybe horrible, or something like that.
For instance, a lower denture it's not a good prosthesis. For some people, unfortunately, it's all they have or think they have.
Okay.
And we'll make the best lower denture we can make, but the best lower denture you can make
is terrible.
It's bad. Yeah. It's a good denture is good compared to a bad denture, but compared to real teeth, no denture is that good.
You do a procedure where you give them like a couple of implants to give them a full arch of teeth that snap in, snap out.
Yeah, you can do snap in, snap out with 2 implants. You go from not being able to eat a salad or an ear of corn to being able to do that usually with 2 implants. And then with 4 implants, you can get some stability in the back, and now you can chew your steak and everything in the back. And if you want to go up to 4 with a permanent set of teeth on 4 implants, you can do that. If you go to 6 implants, it's just that much more security and safety and longevity for it. So people get a full arch of teeth.
Full arch of teeth. Like on 6 implants. They don't come in and out.
Right. Don't come in and out. Yeah.
And they can eat whatever they want.
They can eat whatever they want. It's anchored in bone just like teeth are.
And do you have a lot of people, by the way, that are wearing dentures where you are?
Yes, we do. Yeah, I figured out based on statistics that within Greater Portland alone, there's enough people wearing dentures to fill up Gillette Stadium where the Patriots play football.
If it's so good to come in and get your denture locked in with dental implants, why aren't they doing it? Why aren't they all doing it? What's your take on that?
I think the number one reason is that people went through a really bad time when they lost their teeth, and when they got their dentures, it was just a relief. They associate going to the dentist with toothache pain and procedures that hurt, and it was unpleasant, and their teeth they were ashamed of their teeth. They were ashamed to go to the dentist. So that's not some place they want to go back to. So they just stay away. And that's
so they don't know their options.
No. And I think if people did know their options and knew the difference between what their putting up with. People just come to a place where they just accept something because they feel like they don't have another choice. They accept that they have to avoid eating out in a restaurant with their friends because their dentures are going to slip, or they might not find things on the menu that they can eat with their dentures. I know people that sneak into the bathroom at night so their spouse doesn't see them take their dentures out.
So you could put an end to all of that.
Yeah.
With dental implants.
Yeah. What a life change that is really for people when they now can go back to doing all these things that they thought they would never be able to do again. It's amazing how many things are affected by having, a denture, not having your own teeth. It makes a huge difference.
How old can you be to get dental implants, to get your teeth locked in with dental implants?
I personally recently put an implant in a man 90 years old. He loves the results. It made a huge difference for him. And I've heard of full implant cases, fixed teeth, permanent teeth, in somebody over 100, believe it or not.
But why would a 100-year-old want to do this?
Randy, would you want to eat and chew if
Yeah,
you were 100?
okay.
Yeah, we all do, right? I mean, that's a huge part of our lives, especially as we get older. There's other things we can't do. That's one thing we can do is eat and chew. And if you lose that, you've lost so much at any age. Well, I can think of a lady that came in one time. She had a denture that she'd had for decades, and she couldn't really wear it anymore. She had no ridge left, and she was sore all the time. She couldn't eat a salad. She couldn't even dream of corn on the cob. So with her, what we did was we just gave her 2 implants, gave her a full set of teeth that were now locked into the 2 implants, snapped right in, and she was able to then eat all those things that she had eliminated from her diet. Corn on the cob was the big thing.
Is that right?
She was able to go back to eating corn on the cob. And can you imagine? I mean, decades of not being able to eat an ear of corn on the cob, it would be amazing.
So you're not too old. You could be 70, 80, 90 years old and
definitely
do this. And what about pain? Because it seems very painful.
People are amazed at how little pain they have with the procedure. Pain is different for everybody. Everybody has a different experience. But in general, it's a very painless procedure and people are surprised. I can think of a lady that we saw the day after we placed her implant, and she just came in and she just couldn't believe that, I haven't felt anything. It's just like nothing happened.
So how soon could they eat?
Well,
after it's done?
Yeah, the day we put the teeth on the implants, attach the teeth to the implants, they can eat.
Now, we talked a lot about denture wearers, okay? Yeah. Now, what about the people that have really bad gums, bleeding gums? They're headed to dentures. What do you say to those people?
Well, number one, sooner the better. The sooner you take care of it, the better it's going to be. And if it's gotten to the point where, okay, it's too late, you're going to lose your teeth, then here's the best scenario for that. You come in, you get the teeth taken out. We would make you some teeth to wear immediately. They're not your final finished teeth, but you have those while implants can be put in. And as soon as the implants are healed, and we can put a full arch of teeth on the implants, and you can have permanent teeth again without the pain and without the sensitivity, without all the bad breath and the shame that goes with really deteriorating teeth. You can turn that all around.
You've made hundreds of dentures, I think you told me, for patients.
Yeah.
If they're watching this show, because you don't like dentures, because they're not attached to anything,
right?
What would you say to them?
Well, I would say, even if you're happy with your dentures, that you can have something so much better, it can improve your life tremendously just by even just doing 2 implants. But ideally, I'd like to see you get permanent fixed teeth again, because that's doable these days. And it'd be like getting part of your life back that's been missing. Now,
you created something very, very unique. I guess it's like a dental insurance plan that you've created in-house for a savings plan for the patients. Tell me about that.
Well, it's an option for people that don't have dental insurance. It's not insurance, it's a membership plan, and they pay a monthly fee. It can be taken out of their credit card, so they don't ever have to see a bill. And then when they come in for their regular routine care, they just come in, it's all covered. It's completely covered by their membership, and then if they need other work done, a crown or something like that, then they'll get a benefit, lower or reduced fee for that as well.
Okay, and what do you call it within the practice?
We call it Dental Health Advantage.
Now, why'd you put that together?
Because we had lots of people losing their dental insurance and saying, I can't get my dental care done because I don't have insurance. They would actually, literally, we'd hear that 100 times. And so we said, well, we think you can have your work done without dental insurance, and here's a way to have something that acts kind of like dental insurance for them.
Where they pay a low monthly fee.
Yeah.
And cleanings are covered,
Yeah.
and all the basics are covered.
X-rays, yeah.
And for the big
Fluoride, yeah.
and for the big procedures like dental implants or whatever,
Yeah.
they get substantial discounts.
Yeah. So even their insurance plan had a copay for the bigger procedures, and so they get something off the procedure, and there's no maximum, there's no claim forms. You know, a lot of the things about insurance that are really a disadvantage are gone.
We talked today, as a recap, no more dentures.
Yeah.
That you can go in, get a couple of implants, and get something snapped in that they could eat, like corn on the cob, things like that, laugh out loud. Are those people usually sedated during this procedure? Oral sedation or something?
I mean, when they're having their implant
Yes.
placed? Actually, no. It's such a simple procedure.
Really?
I mean, we can, and we have sedated some, but it's not generally needed for those people. We're happy to give it to anybody that wants it, though.
Okay, good.
Yeah.
I want to thank you for coming to the show. Very interesting.
Great to be here, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to Dr. Hill, she says no more loose-fitting dentures. Dr. Hill, welcome to the program.
Thank you. Thank you for having me.
Now, for people that don't know your practice, Dr. Morgan's been there, I guess, for many years,
Yes.
more than 20 years.
Yes, he has.
You're his newest member.
Yep, I sure
So
am.
tell us about the practice before we get into the dental implants.
Yeah, definitely. So our practice is located in Gorham, Maine, which is just outside of Portland. It's a great community, and many people move to that area. We provide all services, all different types of services to our patients. We have teeth whitening, and teeth whitening is super popular at our office. It makes people look younger, more confident.
Okay.
We do a lot of cosmetic dentistry. We do veneers and crowns. We have the latest CEREC technology.
What's that?
So that is where we can make crowns right in our office in just 2 hours. So I had a patient come in yesterday, actually. I was practicing yesterday, and he had a broken molar, and in 2 hours, I sent him out with a brand new crown. It was white, it fit perfect, it matched, and he was really happy. And a lot of other dentists in our area, they have to kind of do crowns in the older ways, which was when our patients had temporaries and they had to come back 2 weeks later to have the crown cemented, and you often hoped that it fit. So that's a great thing that we have. We also offer orthodontics at our office. We do fast braces, we do Invisalign. It's great for people that have crowded lower front teeth, or adults that had braces and never wore the retainer.
Okay.
And so they come back and they want to get everything straightened. So we do quite a bit of that. Another big thing in our practice is oral sedation. So I constantly see new people coming into our office because they're nervous and they've heard that.
People don't like going to the dentist, right?
No, I hear it not just once a day, I hear it twice a day.
They
or three
even
times
tell
a
you,
day.
because I've interviewed Dr. Morgan, right?
Yeah.
And, because nobody likes going to the dentist, but you hear it too?
Oh, yeah. Oh, yeah.
Like, how do they say it?
And they say, I just want you to know, I really don't like the dentist. Nothing personal. And I tell them I understand, because, many people have had past traumatic experiences that, make them not want to go to the dentist, and I get that. So the sedation's wonderful for these people, and we have many, many people utilize it, even for just cleanings.
Okay.
So that's a great thing. And then, of course, why we're here today talking about dentures and dental implants. And so that's really the latest trend in dentistry right now.
Now, you went to Boston University. You graduated first in your class.
I did.
Valedictorian.
Yes.
Is that
Yes. Yep. It was a lot of hard work, and I'm very proud of it. Yep. But since then, since being valedictorian, I I strive to keep up with my continuing education, and I've gotten to travel a lot all over, the United States to attend CE, so it's been great.
Now, the newest trend in dentistry, which is replacing missing teeth with dental implants. You're a big fan of this.
Yes.
Denture wearers. What are their options? So if a denture wearer goes into your practice, what are the different options?
So, Randy, the first option would be for the person to have 2 dental implants, and you get a full set of teeth that can be snapped right on to those 2 implants. So kind of a snap-off, snap-on type thing. But it's excellent for patients because they don't have to, deal with when they're talking, their denture's moving, when they're even doing simple things like coughing or yawning or, anything like that, daily life things. These 2 implants allow them to actually be able to smile and talk and have confidence. And it's something so simple that all these denture wearers, they don't know that we can do that for them. So that's something great that we have to offer. So the next level up after 2 implants is to have 4 implants. And so 4 implants is excellent. It acts kind of like, 4 legs on a table. So it gives a complete arch of teeth even more stability. So it allows people to eat carrots and meats and salads. I have patients come to me. I had a patient just the other day, and she was like, "I'm just tired of eating mashed potatoes."
Is that right? Okay.
Yeah, and so she wanted to have, healthier food. And so it allows people to actually eat better. And we see people lose weight after having dental implants placed. You'd think the opposite because now they can eat all these new foods, but it allows you to eat healthier things as well. So that's the next level would be to have 4 implants. And with that, sometimes with 4 implants, you can have that full arch of teeth that's fixed, so they don't have to take it in and out. And other times, with 4 implants, it can be something that they do take in and out.
Okay.
So there's 2 ways. And then the last category would be 6 implants, and that's the best in that it makes people feel like they have their real teeth again. It makes
So they don't come in and out.
Nope, they stay right in place. The only time it is removed is if they come to the dentist, and these people feel like they have their 3rd set of teeth because they come in for their cleanings just like you and I. We just like a regular dental patient. They come every 6 months. We clean their implants, and we clean their gums, and we do an oral cancer screening. We make sure everything looks good. So it's there's many different options for people that have dentures out there, and for people headed to dentures. So many people that have dentures, they're happy with the upper denture. They think, they're getting by just fine, and they think, as we tell them, that the roof of the mouth offers some suction and makes it so the denture is more stable. But with the roof of the mouth covered, you can't taste food like you used to.
All right.
And you can't actually, talk quite the same. When some people come in and they have, and they're new to a full denture, the way your tongue hits the roof of your mouth, it's not the same as, prior when it wasn't covered with plastic in the denture. So that's the great thing with 6 implants is the roof of the mouth doesn't have to be covered. So all of a sudden, you're tasting food like you never have before, and you're talking the way you used to talk when you had your natural teeth. So.
It does seem painful though.
It's
what
not.
About pain?
It's not. It has I feel like it, has kind of a bad reputation, or you'd think it would be, but it's not. There are people, that come back and they say, that was it. That was no problem. And so.
And they're sedated sometimes, right?
Sometimes.
Or they have an option to be sedated.
It's completely up to them.
Okay.
Some people just love the sedation, and we see people that they just want to be sedated all the time, and that's great. And so for them, we do it. But it's not an issue where, you have to be sedated. We have many people that stay awake and do just great. And even though there is very limited pain, some people do get swelling. There is some discomfort, associated with
obviously
having it
different
done.
for everyone.
Yeah, it is. But, nothing that, some ibuprofen can't solve.
Now, are there a lot of people, and I asked, Dr. Morgan the same question, but there are really that many people in Maine? He said 50,000, 100,000, maybe 1 million in Maine altogether.
Yeah, I liked his Gillette Stadium joke.
Yeah, you could fill Gillette Stadium with people that are missing teeth, that have no teeth.
There are, tens of, probably closer to 100,000 people in just the state of Maine alone.
So I asked him this, I'll ask you.
Yeah.
If dental implants are so good to just snap in, snap out, or a fixed set of teeth, why aren't they doing it? What's your take on that?
So my take on that, Randy, is that people that have dentures, they fall out of the normal dental routine, going to the dentist. And the only times they do go to the dentist is when they have a sore spot or they have a reline, and that's never, something they're happy about. And so, they're probably, sitting at home right now and they're thinking, well, I don't have any teeth. Why would I go to the dentist?
So the last thing they want to do is go see you.
So
they don't know their options?
No,
Is that what you're
exactly.
saying?
That's what I'm saying. So they just, they don't go to the dentist, so they don't know what we can offer them. They don't know about dental implants.
What about age? How old can you be to do this? Like, what are the oldest patients?
So, I've heard and seen in seminars, and some of my colleagues, they've been placing implants on people that are 100 years old.
Now, what if you have bad gums, okay, and you have loose teeth and bleeding gums, and you're headed to dentures? Are your gums too bad to get dental implants?
No, definitely not. Your gums are never too bad. Once the bad teeth are removed from the mouth, the gums become healthy again. The bacteria and the source of all the infection and bad gums, it's removed. So, once the teeth are gone, the gums are healthy, and it's a great, they're the perfect person to put an implant in. They're the perfect candidate for implants.
Now, the people that come in for this, are they skeptical?
Sometimes.
Like where they say, Doc, this is the worst you've ever seen.
Well, yeah, people say that quite often, and I tell them that, I in dental school, I worked in a homeless shelter for 10 weeks, and I tell them, no matter what, I've always seen worse. So I reassure them that they have nothing to be embarrassed about and that they would still be a great candidate for treatment.
So no more dentures. You're going to wipe them out in your town.
That's the goal. That's the,
the traditional dentures.
Yes,
okay.
Yes, exactly. That's the goal. And, hopefully someday in dentistry, the standard of care actually would be to have 2 dental implants and no longer some bottom denture that's floating around. And patients hate dental adhesives, and it shouldn't be something that they have to live with. And so I have kind of a funny story. A patient came in to me a few weeks ago, and she was a newer patient, and she's had her denture for 5 years, and she was fed up with dental adhesives, and she pulled out of her purse 5 different brands of dental adhesives. And she's like, telling me that she's used all of them. She's tried to mix and match them and use them, and nothing's working for her. And so once we told her, about dental implants, because she had no idea that they were available today, she was, beside herself with excitement. And so, this was just a few weeks ago, so we're working on getting the case going, but it's something I'm 100% confident that once she has dental implants, that her life is going to change. She's going to leave the adhesives in the dust, and she's going to be able to talk and socialize and date and smile and do all the things that she's been wanting to do for a long time.
And we've talked on the phone, and even with Dr. Morgan, that you give people their smile back, whether it's veneers or dental implants or whatever, but you guys said that it changes somebody's life, that it transforms their life. Yeah,
it does. It does, no doubt. A smile's, the first thing you notice about someone when you meet them. It's something, you initially get a vibe from a person based on their smile, and that's the first thing you notice. And one other funny story quickly is I had a friend that I did some cosmetic dentistry on, and he's in sales. And so, he emailed me last week and he said, Kelsey, all of a sudden my numbers have skyrocketed. His sales were improving greatly because I think he was much more confident with his smile, and he had, just a better vibe about him. So that's just one example how a smile can really make you more successful. It can get you jobs.
Because of your confidence.
Yeah, exactly.
And so you're in Gorham, right? Yeah. So do you spot people walking around that are frowning or covering us or like hiding their smile? Can you pick up on that? Can you see it?
Yes, I definitely can. Even at the mall, there are definitely people you see that don't, intentionally don't smile with their teeth because I think they're embarrassed for whatever reason. But, they don't need to be. They should come see us, and we'll get them spruced up.
Now the denture wearers, because I feel like I could spot a denture. How real can you make these snap-in dentures look?
You can do a lot with them. You can customize the gum color and match it to what they have. There are certain tooth shapes that are built for females and males. You can we have people bring in old pictures of themselves when they had teeth, and then we match what our denture looks like to what they had. So, you know, if they go to a reunion, no one's seen them in 10 years, they'll think, you know, oh, that's the same guy's teeth. So.
And now, back to for the denture wearers, or even for the people that all their teeth have to be extracted, after it's all done and you put the teeth on top, how soon can they eat?
So they can eat right away. We tell them in the beginning to have softer foods, but there's never a time where a patient can't eat. You know, that's cruel to do that to someone, so we would never do that. You know, and then as they progress, they move on to harder foods, and then eventually, you know, when everything's stabilized, they eat the carrots, the steak, they eat the ribs, everything they've wanted.
Now, what about people just missing one tooth, okay? And I talked to Dr. Morgan about this.
Yeah.
Would experts agree that a dental implant over like a bridge?
Yeah.
And is it more expensive to do a dental implant?
You know, dental implants are excellent because, you know, you don't have to disrupt the teeth on either side. You don't get cavities on them. They're permanent. So, you know, if it's a younger person and they get a dental implant, I always tell them it's a life investment, because say they're 80 and they lose all their other teeth. You know, they'll still have this implant that we can build off of. You know, a dental implant, whether it's going to start with just one tooth.
So it's single tooth versus a bridge.
Yeah.
What's more expensive?
A bridge is usually.
So then an implant would be better, because I know you do a lot of bridges every day.
We do, yeah.
But an implant would be better.
Yes, it would be. If, you know, the teeth on either side of this missing tooth, if they need treatment, then a dental bridge is a great option. But if the teeth are healthy, undoubtedly an implant's the best route.
Okay, good. So final message to somebody watching this, they're wearing a denture, and they think their denture's fine, right? Or the person that is headed to, their mouth is a mess. And maybe they're skeptical about dental implants. What do you say to them? About getting a fixed set of teeth or something that snaps in, snaps out?
I would tell them to come in, at least give us a call and find out their options. You know, most denture wearers, they think that their denture is great, but they don't really know what else is available. And I would tell them that they would realize that their lives could be vastly improved by having dental implants. So at least come in, find out the options, and see what we have.
Okay, good. I want to thank you for coming on the show. Very interesting.
Thanks for having me. I appreciate it.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.